The ideal candidate for weight loss surgery is someone who actually recognizes the negative impact that their obesity is having on their lives, and they're ready for a change. There are three operations that we perform: the lap band, the sleeve gastrectomy, and the gastric bypass surgery. The lap band is an operation that's been around for about 10 years. We place the band around the upper portion of the stomach. We achieve a certain compression that's appropriate for the individual, and once we achieve that compression, we get our expected outcome, which is where someone will lose at least half of their initial overweight. The unique advantage of the lap band is that it's a reversible operation. It's something that we can remove, and the stomach anatomy goes back to its original state. But its limitation is that the weight loss tends to be less statistically over time. And another limitation is that we are dependent on a foreign body or device to achieve this. Second operation is the gastric bypass surgery. The gastric bypass surgery I like to think of as the most aggressive approach. What we do is we divide the stomach near the top. We completely divide this area away from the remainder of the stomach, and we make a new connection to your intestine. We're bypassing the rest of the stomach, which has a function, and this rest of the stomach remains, but we're detouring the way the nutrition flows. It's a very powerful operation for people who need to lose a massive amount of weight. It's a powerful operation for people who have severe medical conditions like diabetes or sleep apnea. Unique limitation is that it's not reversible. We've changed the anatomy of your stomach. We've changed the way your nutrition flows through your body. And potentially that can lead to some vitamin deficiencies that we really have to keep our eye on long term. A third operation that we do is called the sleeve gastrectomy. And it's really intermediate in how aggressive it is and intermediate in the weight loss results. The sleeve gastrectomy is an operation where we remove 75 to 80% of the stomach. That gives us very significant weight loss. Unique advantage is that we're not dependent on a device. We're not rerouting the flow of the nutrition. But of course, its limitation or disadvantage, just like the gastric bypass, is that it's not reversible. Depending on the type of operation that someone has, recovery time can be from a matter of days to a week or two. The band, the gentlest operation, least aggressive, recovery is just in a few days. Almost all people get back to work in under a week. The sleeve gastrectomy recovery is about a week, but it depends in part on how physical their job is. Gastric bypass, more aggressive operation, recovery is about a week or two. With respect to the risks of surgery, they're extremely low. In fact, the risk of not doing surgery, the risk of maintaining obesity and the medical problems that they have, that risk is higher than any risk of surgery. With any surgical procedure, there is the potential for surgical complications. The potential complications for the band, number one, would be a possibility of erosion. Number two, slippage of the device. And number three, the device fails. With the gastric bypass, there's potential for leak, bleeding, and long-term possibility of vitamin deficiencies. The potential complications for a sleeve gastrectomy are leak and bleeding. So when lifestyle changes are combined with this powerful tool that surgery provides, we expect patients who are healthier, live longer, have more energy, and an absolutely better quality of life.